guys, and welcome back to another episode with Mel the Physio. Today we're going to talk about tendon issues, so what we call tendinopathy. Oh, my elbow's really hurting and I don't know why. Well, could it be a tennis elbow? Is it a golfer's elbow? Or what do they call it nowadays? Sounds complicated, right? But it's actually a very common injury. So tennis elbows you've heard about, golfer's elbows you may have heard about, plantar fasciitis, Achilles tendon issues. Like these are very, very common injuries to the tendon. Whether you're an athlete or someone who just works in the office or is on your feet all day, this tendon issues and injuries can sneak up on you and catch you by surprise. You're just like, why does this happen and what is going on? So today I'm going to explain what tendinopathy is, the causes and the symptoms, how you can treat it efficiently. So no more guessing, just simple, actionable steps to get you back on track. So first we have to understand what a tendon is. A tendon is a cord of strong, flexible tissue made up of mostly collagen. Like you get blood vessels as well and nerves as well, but it's made up of mainly collagen fiber, which is similar to rope. So you can imagine it's the rope that holds the muscles to the bone, So, and the function is to not only hold it in place, while you're moving, it's holding that muscle while it's contracting and relaxing, but also as a shock absorber. So as you're running and jumping, the tendon, which the muscle is doing, the tendon is actually absorbing some of that shock so that it's not too much for the muscle and or the bone. So not only is it something that is a rope that holds things together, but it's also like a shock absorber. Our bodies are made out of thousands of tendons from your head to your toes. The Achilles tendon, which connects the calf muscle to the heel bone, is the biggest tendon in our body. So then we go on to think of what is tendinopathy. So tendinopathy is then an injury. So you get a strain, micro tearing that happens in that rope-like structure, which is the tendon. So then you get pain, of course, and reduces your functionality. And when you have an injury there, you'll feel it, So we need to check on what are the types of tendinopathy, because you can say, I have a tendon issue, but what type of tendon issue do you have? So when you strain your tendons, again, like I said before, small tears, micro tears can happen in that rope, on that collagen fibers. Because tendons are strong, when they tear, it takes a long time for them to heal because the blood circulation isn't that great in a tendon. If you have a tear closer to a muscle or closer to a bone, those two have a very good circulation. So your healing time will be faster. But if you have a strain or a tear in the middle of your tendon, it's a bit slower. So knowing what type of tear it is or a injury it is or a strain is really important, and the location also may have an impact as well. Okay, so just to give you a better idea about the different types of tendinopathy, for this I used my sister's Maggie board. Now I went and I said, it's better if I had a board for this show. It's good if I can show the people. And my sister was hiding her Maggie board behind the curtain because she had been drawn on it with some friends and she was little and she was remembering those times that I said, please, can I borrow it? And so what I did was I took a picture of what she's drawn and framed it. And then, she allowed me to then erase the sweet drawing. And so that's why I can use this Maggie board today for you. So basically, I've taken it in a very simplistic way. I've shown it on a whiteboard. So it's like going back to science class, but don't fall asleep. Not that science is not boring. Science is cool. Just remember that. But back to tendonitis. Don't get distracted. I'm talking to myself here. So first we have an injury. So we'll talk about that later, what kind of an injury. And then you have an acute inflammation that happens in the tendon. So this is what we call tendonitis. What can happen is you can have, definitely you will have pain. Around the tendon, you might have swelling. It might be red and warmer than other body parts. That's normal inflammation reaction. You might also definitely not be able to move as much, so your range of motion and functionality will reduce, and also the tolerance to exercise. So you won't be able to lift as much as before, or you won't be able to do as much as you did before with that certain place. So that's the acute response. So the tendinitis is an acute inflammatory response to tendon injury. If you don't get help immediately, or you keep the injury for too long, it can become chronic. So that's what we call a chronic tendonitis. And that is having a tendon injury for a longer period of time, which then can go into scarring of the tissue. It can also go into calcification. Now, sometimes we may have seen on an MRI or something, your tendon has got calcified. That's because you've had it for a very, very long time. Or another thing we call tendinosis, which is actually a change in the structure and property of the tendon, of the collagen fibers. So that is a chronic response, which then also has an impact on rehabilitation. It takes longer to heal as well. You can get muscle atrophy because that tendon won't be able to take that load anymore. The strength will be less and the flexibility will be less in tendinosis. So you get muscle atrophying, you get tendon even rupturing, or then disability. So you might not be able to move as much on one side, so you get compensation movements and lack of movements as well. So this is what the different types of tendon injuries are. So now let's look at the causes on why we get tendon injuries. So many tendon injuries begin as sports injuries. So that's the most common way of injuring your tendon, because a certain sport may have caused it, but it doesn't have to be the case. Like you can have a tennis elbow but not have actually played tennis at all. And that is it could be a repetitive thing that you've done. You may have suddenly started a sport before that you weren't as active, and you suddenly started doing a sport at a really high intensity and then injured your tendon, because the tendon has to be used to that load. So you've then overloaded it. So overloading injuries can happen and damage your tendons. Like back to the tennis elbow, you can have golfer's elbow, swimmers, there's a swimmer's shoulder, jumper's knee, but you don't necessarily have to have done those sports to get those injuries. It depends from person to person on how much load that the tendon can take. So you may have someone being able to do a lot of sports and not getting injured at all. Their tendons may be really great shock absorbers, and someone else will get injured faster. That varies. That we don't know the reason why. It varies from person to person. So also in athletes, for example, if they overtrain, so they don't rest enough or they don't stretch or warm down, they can also get tendon injuries like that. If you've changed your shoes, or if you have an old pair of shoes and the profile's worn off, these can also cause tendon injuries. Maybe you have equipment or training gear that's a bit older or can cause higher load on your joints and tendons. That can, like if the quality is lower, it can cause tendon strains and injuries. Any action that's repeated too often without rest, warm down, or stretching is called repetitive strain injury. For example, you just have a feeling of doing some spring cleaning, and you're cleaning all day and you're just scrubbing the windows and everything. I mean, you're gonna feel it. Maybe you might get a tendon injury. If you've been typing and you're not taking breaks, you're just typing and typing all day long, so months on end, yeah, you might get a tendon injury. You're gardening, all of a sudden the weather's good, you want to mow the lawn and cut the shrubs, yeah, you might get a tendon injury. Sewing, maybe woodworking, something that you do repetitively, like weight training, that can also cause repetitive strain on the tendon. Straining a tendon is often also when you're doing high intensity workouts even. So if you have a poor work ergonomy, or again in the gym, if your technique isn't that good and you've just put on the weight training without actually checking your technique, you can injure your tendons too. Certain autoimmune conditions can also affect tendon quality, and can cause injury as well. Also medication. Some of the medications we take, the side effects are tendon injury, can cause tendon damage. So those are kind of causes that we can expect. Now we'll go to a very interesting part, which is the diagnosis and the testing. So how do I know I have a tendon injury, and what kind of tendon injury do I have, and where is it, and what can I do about it? So when I have an injury, I always want to know what do I have and what can I do about it? Those are the key questions you have to have. So it's not really good enough to say, oh, I have a rotator tendon issue. You need to know which one it is. So what's key is knowing what you have. If you have a pain over months, like if you have a pain in your tendon over months, weeks to months, you need to go and consult a health practitioner, so either your doctor or your physio, to find out what's going on. Don't keep a tendon issue for too long, because that'll affect how fast it heals. So the faster you go get help and guidance, then the faster that the rehabilitation is. If you wait too long, sometimes that'll also affect the healing time for sure. Then you can also, so the first line is physical exam. So you go to your physio, they'll do an exam, or your doctor, they'll do a physical exam. You can also check by doing an ultrasound scan or an MRI scan. These are ways that we can find out, okay, what's going on in my elbow or knee, or, so you can check that as well. The key is also accurate diagnosis. So you can have an acute tendonitis, like I showed you before, and that can last from 2 days or 0 days to weeks. That's acute inflammation. You can have a tendonitis, which will last from 3 to 7 weeks, the healing time. You can have a tendinosis, which will take longer. It will go from 3 to 6 months. And then if you have tendon repair surgery, that can take up to 12 weeks to heal. So knowing which type of tendon injury you have, and then there's quite a clear guideline on how long it'll take me to heal, when you know which one it is and where it is, so then okay, I have this injury, it'll take me 3 months to heal, that's clear. Then the way you cope with the injury is much better. We have to also consider factors that affect healing. So blood supply is a very important part. As I told you before, the tendon blood circulation is not that great. Depending again on the location, but it in general doesn't have a very good blood supply. So if you have this tendinopathy, you want to make sure that your blood supply, overall circulation improves. So I always tell my patients, even if you have an ankle injury, work out your upper body or do some movements with your upper body. Similarly, if you have an injury in your shoulder, you can still do, you can go for a walk, you can still work out your lower body, because that'll improve the overall circulation, and a better circulation, faster rehabilitation. The other factor is age. So the older we are, the longer it takes for the healing to happen. So that is also a factor that can contribute. If you have an underlying condition like diabetes, that can also slow the process of healing. And if you're repeating an activity, so I used to have patients who worked in a factory that they had to do repetitive movements. They couldn't stop because of work. So that can cause re-injuring quite quickly. Okay, so let's now get into my favorite part, which is treatment. Again, I want to stress on how important it is to get the accurate diagnosis. So making sure what you have and what to do is very, very important. How long it will take. So it determines the treatment and accurate diagnosis. How long you have the injury for also determines how long the healing will take. So if you've been with this injury for a long time, then the healing will also take equally long as well. So usually when you go to a therapist, the first way of treatment is conservative, a conservative way of treatment, which means non-invasive. So you go to your doctor and then you'll be like, okay, what can we do? And they might send you to the physio, or you go straight to the physio, and then this will be the way that you'll treat it first. So they'll recommend ice, rest, physiotherapy, maybe anti-inflammatories if your pain is really high and the inflammation is very high. And if the first line of treatment doesn't work, then there's always other ways, like you could do therapeutic injections, there are shockwave therapy, and then in worst case scenarios, surgery as well. So, but usually conservative treatment is really effective. That means, with the modalities we have in place, you can get really an effective treatment. So when my patients come to me with any tendon issues, my main focus is calming down the inflammation. So as we said before, like the inflammatory things like the swelling, the redness, the pain, usually I'll recommend ice as treatment. Then I'll say, okay, we need to calm down the area, the muscles, the tension has to calm down, improving range of motion. And then also we do a type of strength training, which I'll show you later, eccentric strength training. So eccentric strength training has been proven to show amazing benefits to tendon healing and rehabilitation. It's what it is so you'll have a type of strength training where, let's say we'll take the bicep, you'll make the bicep come closer together. That's concentric strength training. Isometric is where you keep the weight at a certain point and the length of the muscle doesn't change, so that isometric strength training. Eccentric is as the muscle is contracted, it's also lengthening at the same time. So it's in this position and you are lengthening the muscle as it's contracted. That's eccentric. Eccentric is great for tendons. It's so effective. And I'll show you later what kind of strength training or kind of exercises you could do eccentrically. So it's very, very effective, doesn't show any adverse effects to the tendon, and just gives you, so it's actually very simple, the treatment plan. It's just making sure that you're managing your pain, you're coping well and getting back into movement, into functional movements. That's the key. So, and then also that you're doing the specific strength training depending on where the injury is. So that's why get the accurate diagnosis, know what you have, then you really are put onto a great guide in terms of rehabilitation. It makes the world of difference and you'll have really positive results very quickly. Let's talk about prevention. You can't 100% prevent tendon injuries because it might happen during a sport or when you're working. Sometimes you can't completely prevent tendon injuries. However, you can take steps to reduce the likelihood of you getting tendon injuries, such as like making sure you take breaks. If you're typing all day, making sure you do some stretches, give your tendons a break, actually, because they're always trying to shock absorb all that the muscles are doing. That's a lot of stress for them. So getting into healthy habits of moving and stretching, taking breaks, being more dynamic really helps as well. Sometimes also taking rest is important. Working with a coach or a trainer may really help in, let's say, if you're going to the gym, sometimes making sure your technique is right or you're loading on the right way. For example, sometimes you want to put the weight on very fast. So muscle strength happens very quickly. But the tendons, the collagen fibers, the strength of that takes slower. So you want to match muscle strength gain and collagen or the tendon strength gain at the same time. You don't want to have the muscles growing too fast and the tendons can't keep up. They will get overloaded and then it may lead to strains and injuries and micro tears. So you have to load your muscles and your tendons at the same time so that you're not injuring them. If you do have a tendinopathy, I'll give you some of the do's and don'ts in injury and rehabilitation. So what you should do is definitely get a specific diagnosis. I said this a lot of times today, but it is really important. I see it all the time where my patients are just not sure what they have, but it is really important. Know what you have. Knowing is half of the work done. When you know what you have, you cope with the injury better. You know, okay, this is what I have. This is how long it takes. This is what I need to do for it. And then the healing is great. And you're not so scared. Like if you wake up in the morning and you feel a little stiffer, because that's the sign. Usually that's the last thing to go, morning stiffness in tendon issues. You'll know, okay, this is normal. This is great. It's like if you want to also go through a forest, like you're going through the Singaraja forest, you want to have a good guide. You don't want to go there on your own for the first time. So the guide is also really important. If you're not sure about your injury, having a good therapist. So physiotherapists often, that's where we come in to guide you through your rehabilitation. And the physiotherapists will often have a look at rest and the balance of rest and rehabilitation. And that's really important. Long-term changes you also want to make sure you do. So if you have this injury in the future, then once you've healed, you want to make sure that you have or you adapt your work-life balance so that you're not overdoing one thing. You're taking breaks. If you have to do a repetitive movement, like I had one patient, she was doing batik. And then, of course, those movements, which is art, it's beautiful, but it's a repetitive strain on the elbow. So take breaks is my thing. And you're just adjusting your work-life balance really well by doing that. And then you're not getting the injury coming back again. Sometimes the jobs we do, it is an occupational hazard, I call it, where you have to do repetitive things. So that's why manage that really well. That is what I would say. And maybe check your equipment if you're a gym goer, or if you have if you're walking daily, check your shoes, check the profile of the shoes. If it's wearing off, maybe it's time to get a new pair. Or if you have some gear for the gym, make sure that they are good and it's not giving too much load on your body. Or if there's wear and tear in some of the equipment, that you make sure that you're doing things that are healthy and not re-injuring. What you don't do, ignore the pain. Don't ignore the pain. I understand sometimes if you're doing something repetitively, you're like, I have this pain today, I'm gonna be okay tomorrow, and then it's tomorrow, and the next month, you just keep it going. And the way that we feel pain is also different person to person. So you might be someone who's like, I was a rugby player, or I don't feel anything. I feel no pain, but it's actually there. So don't ignore it. Listen to your body. Your body's telling you something. There's something wrong. I need to get help, or I need to take rest. Your body has no way to communicate with you other than through pain, swelling, heat, and color change, like it becoming red or something like that. So that's the way your body is giving you a message. Hey, go get some help, or take a break, or let it rest. And we as humans, we've slowly forgotten to listen to those signs that the body gives us. So make sure if you have pain, go and ask a doctor or a physio about what's going on, especially, and that's in general with injuries, but with the tendinopathy, go and get help, because you will get put right onto a good track, a good guide, good rehabilitation plan. Okay, and then don't lose heart. So tendon issues, because they are not well circulated, it does take time. So don't give up. And I'm telling you, once you know what you have, you know the time frame, you'll be able to cope better. But sometimes you might be frustrated, this is taking forever, and that's normal. That's a normal response. But don't give up, you just keep going, get the right type of help, get onto a right plan, and then you'll be fine. Okay, guys, so back to what eccentric training is. So I've told you to do the icing every day. I told you to loosen the muscles to reduce the tension around, and then we go to eccentric training. So let me show you what it is. So basically, I have a weight here. We're doing a bicep curl. So the curl is concentric strength training. Holding the weight at one level is isometric training. Eccentric training is you've pulled the weight up, and you're slowly letting it go. So the muscle is working here, or else the weight would fall down, So eccentric is, as the muscle is contracted, it's also elongating as well. And that's eccentric training. Very efficient for tendon issues. Now, when we take a tennis elbow, the easiest exercise, eccentric strength training of the triceps. So you take a band, that's the easiest way. You can tie it to a window frame, or a bar, or somewhere, or a door. Just make sure the door is closed. Make sure that your wrist is straight, your elbow is diagonally facing upwards, and you're going to extend your elbow quickly, slowly come back. Extend the arm quickly, slowly come back. That's the exercise. Very efficient, very easy for a tennis elbow. There are, of course, other exercises that you could do for tennis elbow, but this is a really efficient one to do for that. And if you need more exercises, you can always ask your physio. There are tons of exercises, but for me, less is more. Have to be efficient. So this is a really good one. This is for Achilles and plantar fasciitis. You actually can do one exercise for both. It's really easy. You just need a step. So you get that at the staircase usually. And there we do eccentric calf raise. Let me show you. So basically, this is a calf raise, but an eccentric calf raise, really great for Achilles tendonitis and plantar fasciitis. You need to have your front foot on the step and the heel is out in the open. And what you're going to be doing is you're quickly going to raise your heels up into a calf raise and slowly let the heel go down beyond the step. Quickly up, slowly down. That stretches the plantar muscles, flexors, and also is great for the Achilles. So it stretches out the calf as your foot goes down. So that's it for today on the episode of tendinopathy. I know it was a lot of information, but we've covered the causes, symptoms, the best ways to treat and prevent it. And I know this is a very common injury. So you might not have this injury, but you know definitely someone, maybe a friend or your parent or your kids or someone might have it. So I really want to make sure that this message comes across because I find this with my patients coming in all the time. Knowing is everything. So that's what I wanted to give today. Just a little bit of knowledge on how to do things, what to look out for, and how to prevent it. So recovery takes time, and we have to give that time to our body. We have to listen to our body. And when you have the right approach and the right guide, you'll be fine. And you can overcome it and recover very nicely. And you'll grow as well because you'll really be aware of your body in a different way. Sometimes I think about rehabilitation in that way. I think, okay, yes, it's a hard thing to go through. Pain is a hard thing to have, and injury is very difficult. But once you've recovered, you've grown as a person because you learn patience, you learn how to listen, you learn how to overcome something. So these are amazing lessons that later on and moving forward will really help you. Now let's look at the causes of why we get tendonitis. And so we're the guide through your I just said it again. Your forest. No, it's okay. Weight as well, so that you're not doing that like I'll do that. Then I was like